Fears are rising in the United States and other countries that the Ebola epidemic may be spreading beyond West Africa. Health officials are quick to say that's not likely. We wanted to know the full story and went to one of the country's leading experts for answers. Dr. William Schaffner has more than 30 years' experience dealing with public health.
Well, if that's true, then that needs to be examined, and we all need to learn a lesson, because we've been telling everybody in our emergency rooms, any doctor actually, who sees a patient with fever, any patient with fever, to ask two questions. Have you traveled outside the United States? And if so, where have you been? And if you've been to West Africa recently, you have to put Ebola high on the list of differential diagnoses.
Let me ask you, the last time we spoke, I think it was the end of July. At the time, we were talking about why Ebola is infecting more people now than previous outbreaks. The case of this man who's now infected in the United States, does this change your outlook on containing the virus?
Oh, not at all. Certainly in the United States, we're absolutely sure Ebola is not going to get a foothold. We're going to follow up all those close contacts and watch them very carefully. The people who are giving him care in the hospital are going to be using appropriate infection control gear and procedures, and so that will be done very, very thoroughly. I don't think we'll have anything. There may be one or two cases, we can't tell, but Ebola is not going to get a foothold in the United States.
Over the last couple of days, we've heard from the person who runs the U.S. health agency called the Centers for Disease Control. I want you to listen to what he said about the outbreak. Take a listen.
We've stopped every Ebola outbreak that's ever occurred in Africa until this one. And this one could have been stopped if we had gotten in there earlier.
Very strong words. How true is that statement, and that this all could have been prevented? And is it so difficult to squash quickly now as a result that we maybe got a slow start?
Well, Dr. Frieden is correct. We can do the routine public health work very well, and we have to marry that with very good clinical care. We need the clinical care in order to have people have confidence in the care, and so they'll transfer their sick family members to the hospital for care, and thus we can interrupt the cycle of transmission, because a lot of the transmission is occurring in homes, family members caring for their ill loved ones.
This story has so many dimensions to it. I heard somebody last week who was in Liberia talking about the fact that people are dying from Ebola. They're being stacked up outside the hospital, where perhaps you're in the ward and you've got Ebola and you're staring out at a stack of maybe 10 bodies lined up because they don't have the necessary equipment to bury them properly because the planes aren't flying into these stricken areas. You're hearing that dimension of it. You're also hearing the fact that perhaps some medical personnel don't want to go because of the fact that perhaps they could contract the disease. As you look at the totality of it, what's your biggest concern at this stage?
Well, my biggest concern is that we not give up hope. We have to persist in our efforts. Our personnel are over there working hard. This is going to be a fight against Ebola that will take several months. We're going to have to persist. We Americans cannot expect a really quick response. This will require persistence.
No quick response, persistence, as you say, but the worst case scenario is that a total of nearly 1.5 million people could be infected in the months ahead. How likely is that, and what will it take to prevent that?
Well, what it will take is continuing good public health work, getting all the contacts of affected people, and then doing all the medical care, which includes appropriate burial of people who have succumbed. Those two things being done better and better and better in all of those countries, I think will eventually get our arms around this outbreak and terminate it.
Dr. William Schaffner, always a pleasure talking to you. Thanks so much for finding time for us today. Appreciate it.